All right, so we're going to start our section now on health surveillance, poultry husbandry, and vaccination. And we're going to get going with Akshaya Annapragada on poultry vaccination and the reduction of bushmeat hunting.
Good evening, everyone. I'm Akshaya, a sophomore at the college here, studying applied math and bioengineering with a secondary field in global health and health policy. And I'd like to talk to you about some of the work that we're doing in Madagascar to see how vaccinating chickens can improve food security. So I think, as Sabrina mentioned, in many remote Malagasy communities, as many as 50% of children exhibit growth stunting and malnutrition. And this is in part due to low nutrient availability and food security. Historically, communities have hunted and eaten wild meats, things like lemurs and bats. But unfortunately, due to overhunting and environmental change, these stocks are declining, and in consuming them can pose a risk for zoonotic disease transmission. This leaves communities in a tight spot. The nutrients that they and their families need are becoming harder and harder to obtain and may be dangerous to consume. So in response, many communities are turning to domesticated poultry, namely chickens, as an alternative. Now, chickens are great because they're a top taste preference, they have low environmental impact, and the Malagasy consider them to be a female-owned asset, meaning that benefits are reaped directly by vulnerable women and children. There's just one issue. Newcastle disease is a respiratory and nervous system disease that is endemic to Madagascar and nearly always fatal in chickens. It's also exacerbated in the closed conditions that these remote poultry flocks are enclosed in, under the raised huts in which people live in. So our data shows us that in a given month, 15 to 20% of chicken flocks die, namely from Newcastle disease. And this means that chickens are just not a good investment. They often die before they can be eaten, bred, or sold. However, we think that with the Newcastle Disease vaccination program, we can start to change this. So I'm using the tools of mathematical modeling to see what these interventions would look like and how they can benefit communities. So the first thing to look at is the population dynamics operating on chicken flocks. We can think of these populations as having inputs by way of births and purchases, and outputs from deaths, eating, and sales. And the Meharry team has actually been collecting data on all these factors, going back to 2008. And when we analyze this data, we see that on average, outputs are larger than inputs. And when we model this as a differential equation, what we find is that these chicken flocks have a half-life of about 6 months and are exponential decline. This means that chicken flocks are just they're unsustainable, they're highly variable, and they're just not economical food sources for communities to rely on. So we're currently piloting a Newcastle disease vaccination program, which is in its very early stages, where we're vaccinating chickens every 4 months. So I wanted to incorporate this into the model. So we've expanded this to a system of differential equations that considers 2 populations of chickens, both an unvaccinated population and a vaccinated immune population. And this system of differential equations has a numerical solution that tells us that at 29% vaccination coverage, that's when we can start to stabilize populations. So if you look at the phase plan trajectories with the arrows representing forward time, what you can tell is that below 29% vaccination coverage, it's not possible to stabilize these populations. But if we can hit that number, we'll start to see chicken populations stabilize and eventually grow. However, how quickly can we do this? What does this mean for human livelihoods and communities in Madagascar? So if you look at chicken populations over time, at different vaccination coverage rates, we see the pretty obvious result that higher vaccination coverage rates give us higher proportions of vaccinated chickens, and the populations grow more quickly over time. So in a perfect world, we would just vaccinate 100% of chickens. But this is clearly not feasible due to limitations on the cost of the vaccines and difficulties in recruiting and training paravets and taking them and the vaccines to what are, after all, some of the most remote locations on Earth. So this is where herd immunity can be a useful metric. This refers to the point where sufficient numbers of chickens in a population have been vaccinated that outbreaks of Newcastle disease can no longer spread. And the literature reports that for Newcastle disease, this target lies around 85% of chickens in a population being vaccinated. So we can use this model to start to predict what kinds of vaccination regimes can take us there. So for example, over 15 vaccination rounds, or 5 years, if we can consistently vaccinate 36% of chickens in each round, we will hit this herd immunity target. And we can use this model to flexibly tailor vaccination regimes to the available environment and resources. And that's really what's so exciting, because when we stabilize chicken populations, we see communities start to eat more chickens, eat more eggs, and sell more chicken and eggs. And this has numerous positive benefits for the environment, the economy, and human health. For example, when communities eat more chicken, then there's less bushmeat hunting. When communities are able to sell chicken and eggs, there's increased income, and these funds can be used for other things, like healthcare and education. Not to mention that eating more chicken and eating more eggs leads to improved nutrition by way of increased protein intake and the ability to use disposable income to purchase diverse foods like beef, pork, and noodles. Finally, eating domesticated poultry rather than wild meats leads to decreased zoonotic disease transmission. So this is what is incredibly powerful about this poultry vaccination program. When we can stabilize chicken flocks, we can see so many benefits on food security in Malagasy communities. So I'd just like to thank everyone who made this work possible, specifically Chris and the Meharry team, and also Dr. Sarah Iams at the School of Engineering and Applied Science for all the advice. Thank you so much.